Welcome to this video. Increasing cases in the UK at the moment and in Europe, but not in Italy. And if we can work out what the difference is between those two lots of countries, Italy and the rest of Europe, that could be remarkably useful. Also, rule changes again at the Centres for Disease Control in the United States, and some other interesting updates as well as we go along. Now, let's start off, I think, with the United Kingdom first of all. So nearly 10,000 new cases in a 24-hour period according to the COVID symptom tracker app. Now this is a great increase, and remember the symptom tracker app doesn't detect asymptomatic cases, so this is quite a big increase. That gives us 87,000 or more symptomatic cases as of today, and this app tells us that cases are doubling every 7 days at the moment. So this is a concerning rise in the UK. We've known it's coming for some time. And if we go onto the app where the link is there, you can go onto your own region and see what's going on in your own region. Let's have a look at Norfolk. And it tells you what's going on in Norfolk. Number of contributors, active cases per million people, and number of active cases estimated. Okay, relatively low population area there. Then what I wanted to look at particularly was going down. We have the trend map here. So let's just look at this trend map here. So this graphic is showing the trends. So 11th of June it was high, went up, down, but you can see the daily dots now are getting further apart, representing the increase in cases. So really there's no two ways around that trend. These cases are greatly increasing, and the app also breaks things down into areas for us. Now this information is based on antigen tests, 8,124 antigen tests from the 31st of August to the 13th of September. And cases are increasing mostly in the north of England, the Midlands and London. Now London, things had been pretty good for quite a long time. We had a lot of cases early on, then they dipped down very significantly, but now for the first time in a few months cases in London are starting to go up again. So that is not the way we would like it to be at all, and to be quite honest it's a bit disappointing because we were hoping for some herd immunity effects in London. And it looks like that is not happening at the moment. So a bit disappointing, really. So north of England, Midlands, London growth areas. R values, where have I gone? There we go. R values, reproductive values, 1.4 for England, that's high. Every person on average infecting 1.4 new people. Scotland 1.3, Wales 1.3, Glasgow and Belfast particularly high rates of growth. And the R value for England of 1.4 means that cases are currently doubling every 7 days. So the cases aren't huge now, or they're a bit bad enough, but does this mean in 7 days' time we'll be getting 20,000 new cases per day? Unfortunately, that is the current trend. Southwest, southeast, east areas doing much better. So do go on to your own area. There's the link for that map we've just looked at. Now the deaths, there's 27 new deaths in the past 24 hours, equaling 41,759. Now we did consider that the infection and fatality rates are dropping, they are going down, but that doesn't mean to say this isn't still a dangerous disease. Of course it is. But that gives us that total there of 41,759. But for the last 8 weeks, getting on for 30% of the deaths where COVID-19 is recorded on the death certificate, that was not the cause of the death. In other words, these people died with COVID-19. Not because of COVID-19. They died with it. It wasn't the cause of death. Now, earlier on, this percentage wasn't so high, but it does mean that that number is now an overestimate. Now, we've had to adjust these numbers before. Remember how they used to count it was they did a test, and then if someone died at any point in the future, it counted as a COVID death whether they were or not. Now it's 28 days. But this is another reason now to reduce the total amount of deaths, because some, and recently a higher proportion, have died with COVID rather than from COVID. Now, although this is good news, I'm not saying it's, we're not saying this is not a dangerous disease. It is. But this is encouraging. So the actual numbers of deaths are probably somewhat less than the 41,000 that's on that current figure from Public Health England. Now, moving on to the United States, we can get the update there on the states. So 6,706,374 cases, getting perilously close to the 200,000 deaths, and 279,000 cases in the last 7 days. And also it's good to look at the trends which this graph gives us, if I can fit it on. Yes, there we are. So obviously higher cases here went down quite nicely, but I think you'd have to say there's been a bit of a pickup in the last few days. So that is certainly an issue from the United States. Now, fortunately, that's not feeding through into hospitalisations at the moment. These are the accumulative hospitalisations. And then we can look at the weekly rates as well and find that they are thankfully still relatively low. These different lines are different age groups. So they're the current hospitalisations in the United States. So most hospital areas being able to cope fairly well at the moment. Now, the rule change I was mentioning from the United States, the Centers for Disease Control and Prevention. Right. Now, before the 24th of August, the rule was they encouraged testing for all who were exposed to the virus, whether they had symptoms or not. So that made sense. Then from the 24th of August to the 18th of September, they changed that rule, and they said people who do not have symptoms may not need to get tested. So contacts don't need to get tested. Now they've changed it back again, encouraging testing for all of those who were exposed. So there you go. Talk about a change, 180-degree change. Quite what is going on there, I don't pretend to understand. Is it political? Is it administration? What is it that's going on? But at least it's back to a common sense approach now, whereas people that have been exposed are being tested. And just to clarify this, I have cut and pasted what it says. Now, clarification made on September the 18th, 2020. Now, I think that the Centre for Disease Control using the term clarifications there is somewhat of a euphemism, to be quite honest. It has been strange, to put it mildly. But now it's clarified, and let's hope it stays this way, because it's now taking the common sense approach. Due to the significance of asymptomatic and pre-symptomatic transmission, this guidance further reinforces the need to test asymptomatic persons, including close contacts of persons with documented SARS coronavirus 2 infection. So they're reinforcing that. But it's the opposite of what they were saying. Saying people who have not had symptoms may not need to get tested. So this is not clarification. This is a 180-degree turnaround, and I most certainly welcome it. But I think that's some pretty frantic backpedaling there from the Centres for Disease Control. But you know, hey ho, they've got it right now. Just if you want to click on these links, obviously I post all of these for convenience. They're the figures for the United States. Click on that for the overall figures and maps and your local area. Click on that for hospitalisations. Now, interesting and potentially remarkably useful information. Italy. Now let me just show you if I can get it here. I think I've got it. Yep. Let's just show you the map here. Now these are the per capita rates. So here we see the daily new confirmed COVID-19 cases per million people. And let's just go in and let's let this information just sink in a little bit, what it means. So, Israel, wow. Israel started off so well and it's just got completely out of control in Israel. Remember, these are per capita figures because the Israeli population is smaller. Although there are stringent lockdown measures in Israel now, so there's no question that these rates will start to drop fairly quickly. But very high at the moment. Then Spain, then France, then the United Kingdom. But look at Italy way down there. How much better Italy has done than other European countries. And whenever you see this sort of difference between two groups, it's always good to think, why has this difference occurred? Can this give us any useful information? Can this tell us things that could help us in our situation? And I believe the answer to that is yes. So let's look at some of the things that Italy has done. Now, the Ministry of Health scientific expert here. Distancing, masks, controlling clusters are the key, he says. Okay. Use of Italy's contact tracing app. That's got to be a significant factor. They are using this contact tracing app in Italy. Now, I don't know what the uptake is, but I understand it's fairly good. I haven't read figures for that. So if you're in Italy and you know the uptake figures, do let me know. They're encouraging the flu vaccine. Well, it's a bit early for that to take effect yet, but good. Now, it's kept its quarantine at 14 days, refusing to shorten to 7 or 10 days. So some countries, for pragmatic reasons, reduce their quarantine to 7 days, which isn't enough, or 10 days. Still not enough. Now, most people, of course, the average incubation period is only 6 days. But for quite a reasonable proportion, it's longer than that. And Italy kept theirs at 14 days. It kept the longer incubation period. So that is obviously one of the, well, not obviously, but it could well be one of the things that's starting to pay a dividend now. Also, another scientist, using its testing capacity wisely. Every time we get a positive case, even asymptomatic, we test everybody who is part of the family social work networks of that person. Right, so that is good to see. And of course, completely consistent with the current guidelines for the Centers for Disease Control in the United States. Now, as of the 18th of September, the guidelines in the United States are now the same as what is a current success story. Of course, Italy suffered appallingly in the early stages of this pandemic. It was the first European country to have significantly larger numbers, so you can understand why they don't want it again. But this is how all clusters are now being handled. So every time we get a positive case, even asymptomatic, we test everybody who is part of the family, social and work networks of that person. And then, of course, they can isolate. So what he's saying is this gives rapid pinpointing of new positives. And I like this word, intercepting new outbreaks. Intercepting. They are sending out interceptors. So before the enemy gets home, they go out and intercept it by isolating all the closest contacts and testing them. Now, Italy did, this says Italy did encourage foreign tourists. I should say Italy did not encourage foreign tourists. So Spain was quite keen to get tourists back again. Understandable, because there's so much income involved. But Italy did not encourage foreign tourists, so a lot of the popular tourist sites in Italy remained really quite quiet over the summer. Again, turning out now to have advantages. Clamped down on the party scene, prohibiting dancing in nightclubs August the 17th. So again, this is one of those situations where the local health authorities were able to identify a particular driver of transmission and be able to close that particular driver of transmission down. So that was the local situation there. They reacted to it. Prohibited dancing 17th of August. And of course it makes perfect sense, because you're going to be dancing, therefore you're exercising, therefore you ventilate more in a closed space. Outside it wouldn't be so bad, but it makes perfect sense. So that's what they did, and the benefits are now being enjoyed. Widespread civic adherence to mask wearing. So people are wearing masks. Now, I was actually in the supermarket this morning, and I saw probably about 100 people in the supermarket. I saw one person not wearing a mask. So that's much better. The public adherence in the UK is getting good now. But in Italy it's quite high. And this other one is interesting and somewhat controversial, really. Where are we? Yeah. Sorry, there I am. So what they've done in Italy is they have had cameras quite a lot in hospital and in morgues, and they have videoed people that are sick, and I believe the video people that have passed away due to this virus. Now, a lot of people would struggle with this. Personally, I have no difficulty about filming in hospitals, as long as the individuals, of course, give full permission. We do this. I've taken a lot of clinical pictures myself. You just get written permission from the patient involved, and sometimes from their doctors as well. So that's okay. Morgues, we could argue about it, but it's one of the strategies in Italy that does seem to have worked. You see, this is real. What we do determines if people get sick, and it determines if people die. So the use of reality TV in Italy is interesting. Now, I don't know how extensive it is. I would like to learn more about that, but interesting strategy. It's a bit like these pictures of hideous cancers that you put on cigarette packets. You know, these warnings: smoking causes cancer, smoking causes heart disease, and then they've got some hideous pathology there to show you what the smoking will cause. So, you know, if that works in Italy, then that's interesting. But there's some buts in Italy. Schools are just starting to open. More people going back to work, and there's kind of an equilibrium. So what they're saying is that, yeah, these are going to increase cases, but all these other measures are going to reduce cases. So hopefully they can balance things out. So interesting. I should look at that graph again. It's really quite a profound graph, isn't it? That's quite a difference between Italy and Spain, for example. So well done, Italy. Let's hope that keeps going. Now, the World Health Organization. I'm just going to finish on this now. It was kind of, you know, the World Health Organization haven't performed as I would like them to during this pandemic. Let's just leave it at that. But they have been kind enough to give us some of their wisdom about the risk of a future pandemic, which of course we've been talking about on this channel for since we started doing these videos, I think. But to be fair, Dr. Tedros is advised by the best epidemiologists in the world, and this is what he's just said. So I do think it's worth going over, straight from the latest press briefing. Basically, he's saying there's going to be another pandemic and we need to be ready for it. Some might say it's a pity the World Health Organization wasn't ready for this one. Some might say that. But now the World Health Organization is saying we have to be ready for the next one. And of course, that bit is 100% correct. Global factors: warming world, intensified human activity, shrinking wild places, displacing animals. This is the key thing. Displacing animals into human ecosystems where they should not be. And of course, bringing viruses with them. Viruses are everywhere. Yeah, viruses are everywhere. It's that simple. Different types of viruses. Likelihood of spillover of a novel pathogen from animals to humans. Yep, that could happen. And it could be even more novel than this one. These spillover events, these zoonotic infections, where the virus spills over from the animal reservoir into the human zoonotically and then spreads from human to human. So the World Health Organization are warning that this could happen. We know for certain there will be more novel viruses, another so-called disease X. So the saying here, the next pandemic is when, not if. And again, well, I've been teaching my students that for the last 30 years. It's always a matter of when, not if. This pandemic was always a matter of when, not if. So Dr. Tedros is advising all the normal social conditioning, all these things, of course, and also advising to keep windows and doors open, do it all. And I was glad to see that he mentioned ventilation specifically, because we're still not getting this right. Oh, I had to go to a pharmacy recently to pick up some meds for someone, and it was really quite stuffy inside. Why didn't they have the doors open? Why not? Why not? Wasn't a cold day. Doors were shut. Windows were shut. Why not have some ventilation? Anyway, there you go. Interesting things going on. So I thought that was just worth doing. I only kind of half planned not to do a video today, but those things seemed relevant and worth talking about. Now, I was getting out of my weekly shower this morning and poked myself in the eye with my thumb. So let me show you. Let me show you what it looks like if you get a bloody eye. You see that? It's quite hard to hold your head in one position and look in the other. Anyway, it gets better in a few days. Nothing to worry about. So, in terms of my role as a health educator, I would like to formally advise you not to stick your thumb in your eye. Welcome and thank you again.